Hello, everyone. My name is Ashley Stroud, and I will be presenting on behalf of Group 10. For our program curriculum, we decided to discuss decreasing hypertension. So, our target audience for this lesson plan are adults 65 and older. So, ultimately, hypertension is an increased risk of cardiovascular disease and by far the most important modifiable risk factor for heart disease, morbidity, and death. So, according to the National Health and Nutrition Examination Survey, 70% of adults that are 65 and older have hypertension. And this is in contrast to adults aged 40 to 59, where it's only 32% of them have hypertension. So, we decided to focus on the 65 and plus population since they have a higher prevalence for this disease. Hypertension is often overlooked by the general population, but if it goes untreated or left uncontrolled, it can lead to very serious health consequences such as stroke, vision loss, heart failure, heart attack, kidney disease, or failure, and much more. So, our goal is to reduce the prevalence of hypertension in adults who are 65 and older. And by doing that, we have these objectives in order to help us reach that goal. So for session one, we have information acquisition for the first two objectives, and then the third objective is more opinion expression. Session two, we are looking at psychomotor for objective four, and some concept development for the fifth objective, and then the sixth is more like opinion expression. And then session three is more information acquisition. So for our theories and constructs, we mainly focus on the health belief model, perceived severity, perceived benefits, perceived barriers, and self-efficacy. But we also wanted to incorporate the social cognitive theory with self-regulation and the trans-theoretical model with self-reevaluation. So this is just a sample lesson plan for our first session. So the first session is basically understanding high blood pressure. So we would just introduce our participants to what high blood pressure is and tips that they can use to help modify how they're treating their blood pressure. So first we have our introduction. So we would go over the goal and then our objectives for the session. For the first activity, it's in line with our first objective. So participants should be able to identify four modifiable risk factors by the time the session is over. So basically, it would just be a lecture discussing these modifiable risk factors. And according to the American Heart Association, a modifiable risk factor is anything that we can change. So basically, lack of physical activity, having an unhealthy diet with a lot of sodium, being overweight or obese, which again leads back to lack of physical activity and unhealthy diet in this situation. Drinking too much alcohol, having sleep apnea can also cause hypertension as well. Increased cholesterol, having diabetes, smoking and tobacco use, and also stress. So for the second activity, the first activity discusses perceived severity. The second activity is a handout review. So basically a review of a pamphlet on how to prevent and manage blood pressure. So the pamphlet would go over best practices for hypertension control, and participants would be asked to list at least three advantages of controlling their blood pressure. So this would be perceived benefits for the health belief model. Activity three is basically our group discussion. So participants would express different barriers they encounter that hinder them from blood pressure management. So basically, if there aren't any healthy grocery stores in their area, or if they aren't able to walk on a daily basis, this is what that group discussion would kind of address. And then we would have a lead facilitator take notes on this group discussion, and this would be for our perceived barriers for the health belief model. So for our other sessions, we have different evaluation methods that we would use. So we would use different questionnaires and then observed group discussion, as I mentioned in session one, different checklists, and then role playing, which would be really good for like the self-efficacy and self-regulation portion. Basically showing our participants how to take their own blood pressures, how to create meal plans and setting goals for themselves so that they can have something to aspire to once the program's over, and a nice way to just check up on if they're meeting the expectations for managing their blood pressure. Thank you so much.